Okay, so let's talk a little bit about responses to stresses and to aging. And we'll start with looking at concept of tanning and responses to tanning and issues lying within that. So when we talk about issues of tanning and what we have to worry about, it's all about UV and UV protection. And it's about what does the melanocyte and melanin give us in terms of protection against ultraviolet radiation. Now, we need to have some amount of ultraviolet radiation so as to activate the vitamin D into its functional form. However, we don't want to have so much that we actually trigger ionization damage to the DNA, leading to skin cancer issues. And so you can look at evolutionarily based off of the latitude of origin of different populations throughout the world, the amount of UV radiation that they get exposed to throughout the year, where if you have higher amounts of UV exposure, you tend to have more melanin expression, whereas if you have less ultraviolet exposure throughout the year, you have less melanin expression. And so that's where we get that delineation of skin pigmentation that we see throughout distinct populations in the world. We also see that same level of pigmentation change based off of seasonal exposure, where you tend to be slightly darker during spring and summer and slightly lighter during fall and winter. And it has to do with how much UV radiation you're being exposed to during those times of the year. So what is UV? UV is a form of electromagnetic radiation that is beyond the violet range within the scope of the spectrum, hence ultraviolet. It's very, very short, which means that it has a lot of energy within it. The amount of energy that we see within these wavelengths is going to dictate how far it can travel within the atmosphere, and then how far can it get into the skin with exposure. Where we have ultraviolet C radiation, which usually gets dissipated by the ozone layer within the atmosphere, which is one of the reasons why we worry about having chemicals in the atmosphere that etch away the amount of ozone protection that we happen to have. Then we have UVB, and UVB has enough energy within it to get into the epidermis and get down into around the basale region of the stratums. This is deep enough in order to trigger melanocyte activity and provide for a tanning effect. And then we have UVA, and UVA has enough energy within it to go ahead and get all the way through the dermis of the skin and actually down into the hypodermis. The UVA radiation is what typically causes the sunburn effect that we will get when we have excessive exposure. Now, for people who don't have a high enough melanin amount, and for people with high enough melanin amount but will have excessive exposure, we have to somehow limit the amount of ultraviolet radiation that the person gets exposed to. And we do this through applying what's referred to as a sun protection factor cream. The sun protection factor cream, or SPF, is the protection factor that limits the amount of UVB damage that can take place, and thereby limit the amount of UVA exposure that we'll also get. And so what it's doing is it's limiting how much ultraviolet radiation can get through and into the epidermis and then down into the dermis. The number is the indication of time to damage versus no screen. It's not the indication of how much actual protection you're getting. It's how much longer can you get without having that protection there. And I'll show you percentages here in a second. Now, the problem with these numbers is that it gives some people a false sense of security, because if you're not applying the sun protection factor cream correctly, you actually don't get the same level of protection that you should get if you just used the cream the way it was intended to. You actually have to lather the cream on so that there's a film of the cream on the skin when you're done putting the skin cream on. And so what we're able to see with this a 7% transmission rate on an SPF 15 and a 3% transmission rate on an SPF 30. Now, we don't actually get that much more protection above an SPF 30, even though people will say, oh, you need to put on SPF 40, SPF 50, SPF 60. The problem is that because we're constantly doing things that will wash away the SPF film, we should be reapplying that film every 15 to 30 minutes, regardless of what the SPF number happens to be on the packaging. And if you're using the spray, unless you are actually saturating the area with the spray, you actually aren't getting a large enough film buildup to provide very much protection anyway. And so what does this UVB, UVA protection do? Well, what it does is it reflects back some of the UV light. And so when we have UVB sunscreen, which is what the typical sunscreen that we see on the shelves at the stores happen to be, what it's doing is it's reflecting back the UVB and allowing some of the UVA to get through. If we have what's referred to as broad spectrum SPF protection, what it's doing is it's blocking both UVA and UVB. And so a lot of the sun protection factor creams that are out there and tinting on glasses is now a UVA UVB protection. And what it's doing is reducing the amount of ultraviolet radiation that gets through the skin, allowing for melanocyte activation and possible damage to the DNA within these dermal cells. Which leads us to a concept that some people will reference as being a pre-tanning episode. We usually don't have pre-tanning so much in California. However, we can get it with the tanning salons where you'll lie underneath the UV lamps. In that case there, you're looking at UVB lamps. The problem with the tanning is that what it's doing is it's increasing the amount of exposure that you get to the UV radiation. And with most of the carcinogenic issues, it has to deal with the amount in lifespan of damage that you get. And so by doing these pre-tanning episodes or going indoors, what you're actually doing is limiting how much time you can tan outside, how much UV exposure you can get when you're outside. The next issue that we're going to look at here is issues of aging. All of these changes that we're going to see here deal with a change of homeostatic regulation that occurs with aging. We typically see a thinning of the epidermis, and that is due to a lower rate of mitosis that occurs within the stratum basale. We typically start seeing a loss of collagen tautness. The loss of collagen tautness is actually a loss of both collagen and reticular fibers within the dermis itself. This loss of collagen reticular fibers leads to a sagging of the dermis, and the end result of the sagging of the dermis is wrinkling of the epidermis, usually in areas of high motion before areas of low motion. Both of these changes are due to reduction of metabolic rates of the cells within the dermis, the fibroblasts, as well as the cells within the stratum basale. Additionally, we start seeing a loss of the ability to heal within the epidermis. This is typically due to chronic inflammatory responses, as well as a cardiovascular shift that takes place due to changes within the vascular system, more than changes within the dermis and epidermis itself. Additionally, we start seeing chronic states of dehydration and hypohydration. This change of dehydration and chronic state of hypohydration leads to a reduction of hydrostatic pressure within the dermis itself, which reduces the overall functionality of the integument and the skin itself.